session, we're going to talk about chef and dengue to reduce mother-to-infant transmission of hepatitis B. Definition: hepatitis B is a disease caused by a virus that causes inflammation of the liver and transmitted by contact with the lung or other body fluids of an infected person. Hepatitis B can also be transmitted sexual as well as from mother to child at the time of delivery. Since the blood and fluids of the mother are in intimate contact with the fetus, between 5 and 10% of infected people can develop the chronic form of the disease with a throughout life. Can lead to liver damage, liver failure, liver cancer, or even death. Application to medicine: healthy newborns should receive their first dose of hepatitis B vaccine to improve their protection against this resistant deadly disease because the first dose is very effective in preventing the infection from being passed from mother to baby when given during the first 24 hours of life. After complicated treatment for disease of hepatitis B vaccine series, 98% healthy babies achieve complete immunity to the virus.
Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let's Get Checked. I'm here today to talk to you about hepatitis, namely hepatitis B infection. So what is hepatitis B? Well, there are a number of different types of hepatitis infections, and B being one of them. So there's also hepatitis A and C and D and E infection, but today we're going to talk about hepatitis B. So hepatitis B is known, or what we call in medicine and medical terms, is a DNA virus, and it affects the liver predominantly, leading to a condition called hepatitis, which is inflammation of the liver. Now, how is hepatitis B transmitted? Well, hepatitis B is transmitted in a number of different ways. The first way to mention is through unprotected sexual intercourse, and this could be oral, anal, or vaginal intercourse. The second way that hepatitis B can be transmitted is through the sharing of needles or infected medical equipment. The third way that hepatitis B can be transmitted is through infected blood products. The fourth way that hepatitis B can be transmitted is through sharing of items such as razors or toothbrushes, because hepatitis B is also found in saliva. So what are the signs and symptoms of having hepatitis B? Well, the good news about hepatitis B is the vast majority of us, if we get infected with it, our own immune systems clear the virus. But in a small minority of patients, they become chronic carriers, so they have a chronic hepatitis, so the virus is always active in their bloodstream. So signs and symptoms of having hepatitis would be, you may have a flu-like illness, so you may feel like you've got a very severe flu, you may be suffering from extreme fatigue, you may develop abdominal pain, particularly in the right side here where your liver is, you might have liver pain, and you might develop signs and symptoms of jaundice, which is classically the yellowing of the sclera of the eyes, and you may develop a severe itch, and this is also due to jaundice. So they're just some of the signs and symptoms of having hepatitis B. So how do you go about getting tested for hepatitis B? The only way of getting tested for hepatitis B is by having a blood test. What are the complications of hepatitis B? Well, as I mentioned, most of us clear hepatitis B ourselves, and we don't carry it chronically. We don't become chronically infected with hepatitis B. However, for the small minority of patients who do get chronically infected with hepatitis B, it can lead to very serious complications. Those complications, as I mentioned, include hepatitis, which is inflammation of the liver. If hepatitis continues unchecked or untreated, it will lead to a condition called cirrhosis. This is hardening or thickening of the liver, and the liver stops functioning as it should. And it can also lead to hepatocellular cancer or cancer of the liver. If you're concerned at all that you've come into contact or you've been exposed to hepatitis B, or indeed you might have hepatitis B infection, please visit our website and let's get checked and speak with one of our nurses, and they'll advise you with the best test that is suited to your needs.
Controls. To avoid it coming into contact with the blood or baby fluids of other people. Avoid sharing personal items. Be careful when getting tattoos and body piercings. Practice safe, get vaccinated. Pros and cons. Pros. Acute bad virus infection during pregnancy is very rare. It does not influence the ability to become pregnant, nor does it cause malformation or disease problem in the child. Cons. Infection with the hepatitis B virus is very common in the world. The risk of contagion to the neighbor is high, oscillating between 40 and 90%, and it does not influence whether the delivery occurs by analogy or by cesarean section.
Every child should be given the best chance to start life healthy and free from preventable illnesses. Mother-to-child transmission of HIV, hepatitis B, and syphilis can be effectively prevented by screening and treatment of pregnant women and their partners. Immunization of all babies for hepatitis B within 24 hours after birth, followed by at least 2 more doses, offers over 95% protection for life.
Kapag nagpa-check up ang isang buntis, binibigyan na namin lahat ng antenatal services. Kasama dito ang pagpapatest sa HIV, hepatitis B, at syphilis sa pinakauna niyang pagbisita.
Kaya po ginagawa yung pag-i-screening sa nanay para mabigyan ng protection si baby kung sakali mang nagtataglay siya ng infection.
Binibigyan muna ng counseling at hinihingan ng consent ang buntis bago magpa-test. Kung sakaling positibo, ini-encourage namin na magpa-test din ang kanilang partner.
Mahalagang makapagpatas ako para malaman agad kung may sakit. Para rin to sa protection namin ni baby.
It is important to have the guidelines endorsed by the Department of Health that include antenatal screening for HIV, hepatitis B, and syphilis. This will ensure identification and treatment of infected pregnant women and their babies.
Nagiging mas madali ang testing para sa HIV, hepatitis B at syphilis dahil sinusunod namin ang guidelines ng Department of Health.
All pregnant women and their partners should have access to good care, including screening and treatment services for HIV, hepatitis B, and syphilis to protect themselves and their infants. All babies should receive hepatitis B vaccination within 24 hours after birth, followed by 2 additional doses. Let's all work together to ensure these services are made available and affordable for all.
Ecuador. Hepatitis B is a notifiable disease and the most important preventive intervention is universal vaccination, which can prevent infection in 90% of cases. In 2014, more than 100 people were tested for hepatitis B, of which 468 were diagnosed with the chronic infection. conclusion, hepatitis B can cause devastating life-threatening illness, even death. So the vaccine is critical to protect babies from contracting or potential serious infection at the time of the delivery.